So here I'm actually using my non-dominant hand to do the Durista implant. You see the counter pressure. And here you see the bimatoprost implant sort of adhering with an air bubble to the injector. So I go back and forth a little bit, and then eventually it just comes off. If you release the counter pressure, the chamber stays deeper, and it's a little bit easier to get the implant off the injector. It happens sometimes. I've even had it where the implant will go straight up. I try to go a little bit below the pupil, and what I do now is a little bit more of an acute angle. You can't always control the angle you go in with because sometimes it's where the patient is moving or looking. I try to have a large beam, and I try to have them look at my ear with the other eye. This is interesting. This is a patient that has a multifocal lens. She's got severe dry eye reaction to the glaucoma medicines. So Durista is an ideal product for her since she has very, very shallow, small orbits, has a lot of reaction to the drops, the medication topically. And here you can see I've released the bimatoprost, but it's sort of adhering to my injector. So I'm going to go back and forth a little bit. I'm talking to the patient the whole time. I'm telling you everything's going perfectly. And I just go back and forth slowly, see if I can massage it. And then I will, at one point, as soon as I'm comfortable, I will remove the injector smoothly, and there's the implant. And I just have the patient sometimes close their eyes. I have them look up and down, side to side, and you just watch this implant. It will eventually just find its home. And you can, as an aside, you can see how irritated this eye is. She really doesn't tolerate the topical medication well. And I'm at this point where I'm, okay, am I going to go back in? Am I going to just gently push against the eye a little bit, see if I can get it to behave? And this is where, as the physician, you don't panic. You just wait. Have her blink a little bit. And it's a learning process for all of you and all of us when you first start doing this. And you just have to trust that this will find its home. I've had individuals where the stent went straight up at 12 o'clock, and I saw them 5-6 days later, and it was sitting at 6 o'clock. Now, obviously these have, they're not dilated. They're pseudophakic, and there is no way that this is going to go into the posterior chamber. It's not adherent. It's not stuck to the penetration site. And I just will wait, and it usually takes less than a minute. And I just have them look around a little bit. You just have to wait for the air bubble to kind of dissipate a little bit. And then the weight of the stent, the eye motion, will have the stent just start to find its way home. And this stent, this bimatoprost implant, will find its place at 6:30. Over the next few days, you can see this thing is just starting to roll down like a log. And it will start to look like a snowball in about 6-8 weeks. And her eye is much happier without some of the medication she was on. And she had a very, very shallow orbit. She was a hyperope with a lot of astigmatism. This was done quite a while back. She has a restore lens. She then had a lot of a cylinder, which I then eventually did PRK on top of her. And she's done quite well. And the whole point of my conversation here about this is to be patient.